Hi, I am Dr. Julie Brown, your trained concussion doctor, board certified chiropractic neurologist, and fellow in traumatic brain injury and rehabilitation. We happen to be filming this little clip on International Women's Day, so yay, go world. And this topic is about females and concussions. Typically, women don't recover as well from concussions. We actually are a little worse. I mean, they're always, how many concussions have you had? There's a whole bunch that goes into the background, but typically women have more connections from side to side, and there's the corpus callosum, so that the right and left hemispheres talk to each other. So that means there's more areas for things to go wrong or to shear or tear or get disrupted. You might notice men in your life are able to sit and watch a football game and focus, and you'll say, "Can you take the trash out?" And we think it's selective hearing, but it's really not. They don't have as many connections from right to left, so they can focus on things a little easier than women can. We hear the noise, we hear this, that, and it's, in my opinion, probably primal to be able to take care of the kids, and we're the primary caregivers in those regards. So I think they're, by design, that's probably how it is. The other thing is menstruating women in particular, get a fluctuation of hormones throughout the month. We know that progesterone is protective on the neurons, and there's research also that shows women who get a concussion in the second half of their cycle, in which the progesterone is spiking and then dropping, when they get it in that second half, they get a quick drop of it, and they do not do as well as women who get concussed in the first 2 weeks of their cycle. That's because at that second week, those hormones may kick up and add some sort of protective or healing benefit to those neurons. We're not sure yet, but it is very common for my female patients to have their menstrual cycles kind of disrupted from this. So, moral of this story is, if you're going to get a concussion and you're female, menstruating female, aim for the first 2 weeks of your cycle, or just don't get one at all. Below is my website if you want to follow, and I'm always looking for YouTube followers. You can click here to subscribe.